Welcome to the Artificial Organs course, led by Dr. Loay Al-Zube. In this journey, we'll explore the fascinating world of substitutive medicine, where science and engineering come together to restore lost bodily functions. Whether you're a student, a healthcare professional, or simply curious, this course will provide a comprehensive overview of how artificial organs are designed, developed, and used to save and improve lives. Let's begin by understanding the basic concepts and the significance of artificial organs in modern medicine. Substitutive medicine is a field focused on replacing damaged or missing body parts with alternatives that restore function. These alternatives can be human-made devices, living replacement parts sourced from patients' relatives, cadavers, or even animals, and increasingly products of genetic engineering. The goal is to address disease states not just by treating symptoms, but by substituting what's lost with something that can perform the same role, whether it's natural or artificial. Placement parts in medicine come from a variety of sources. Human-made devices such as artificial hearts or joints are engineered to mimic natural functions. Living replacement parts may be taken from the patient themselves, a relative, a human cadaver, or even a living animal. With advances in genetic engineering, it's now possible to create tissues or organs tailored to individual needs, reducing the risk of rejection and improving outcome. Facing a disease state, there are several approaches to treatment. Chemical agents such as medications can help manage or cure diseases. Physical means like surgery or radiation are also common. However, when a body part is missing or non-functional, replacing it with a natural or artificial counterpart becomes essential. This approach is at the heart of substitutive medicine, offering hope where traditional treatments may fall short. Statistics from 2006 in the USA highlight the growing impact of artificial organs. Each year, 2 to 3 million people are treated with human-designed spare parts, and around 20 million enjoy improved lives thanks to artificial organs. However, organ transplantation remains limited, with only about 20,000 cases annually due to a shortage of donors. Despite this, there are approximately 200,000 transplant survivors, underscoring the vital role of both artificial and natural organ replacements. Many cases, removing and replacing a damaged organ is more effective than attempting to cure it. This idea challenges the holistic view of human integrity and the traditional scientific approach that focuses on correcting biochemical factors. Yet for conditions like cardiac valve disease, heart block, and malignant arrhythmia, replacement often yields better outcomes. The decision to replace rather than cure is complex and involves ethical, medical, and personal consideration. Body parts are destroyed or worn out. Two main treatment options exist: implantation of prosthetic devices or transplantation of natural organs. Prosthetic devices are engineered to restore function, while natural organ transplants rely on living donors or generous individuals who volunteered before death. Both approaches aim to restore quality of life, but each comes with its own set of challenges and benefits. Natural organ transplantation has evolved over thousands of years. These organs are often overdesigned, meaning they can function well even if not in perfect condition at the time of transplantation. They match the shape and attachment needs of the body part they replace, and the circle techniques are generally straightforward. However, the biggest challenge remains the shortage of suitable donors, which limits the number of transplants that can be performed. Artificial organs are relatively new, with most devices tested for only about 40 years. They are the result of collaboration between inventive engineers, physiologists, and surgeons who focus on restoring function rather than replicating exact anatomical structures. Made from synthetic materials known as biomaterials, artificial organs use mechanical, electrical, or chemical processes to achieve the same functional objectives as their natural counterparts. Like natural organs, artificial organs are designed to achieve functional results using different processes. They may use mechanical pumps, electrical signals, or chemical reactions to mimic the work of a heart, kidney, or other organ. The focus is on restoring the lost function, not necessarily replicating the exact structure. This approach allows for creative solutions, but also presents unique challenges in adapting to the body's needs. Artificial organs, while life-saving, have their limitations. They often struggle to adapt to the changing demands of human activity and cannot easily accommodate body growth, making them more suitable for adults than children. Like all machines, artificial organs have a limited service life due to friction, wear, or decay in the body's warm, humid, and corrosive environment. Despite these challenges, millions of people benefit from artificial organs every year. Biomaterials are the building blocks of artificial organs. These synthetic materials are specially designed to function inside the human body, resisting corrosion and wear. Engineers and scientists are constantly developing new biomaterials that are more durable, biocompatible, and capable of supporting complex functions. The evolution of biomaterials is crucial for the future of artificial organs, enabling longer-lasting and more effective devices. Hybrid or bioartificial organs represent the next step in artificial organ development. These devices combine living elements, such as organelles, cells, or tissues, with synthetic materials. The result is a device that can perform complex biological functions while benefiting from the durability and reliability of engineered components. Hybrid organs hold great promise for the future, potentially overcoming many limitations of current artificial organs. As technology and medicine continue to advance, artificial organs are expected to become more sophisticated, adaptable, and accessible. Ongoing research in biomaterials, genetic engineering, and hybrid devices is paving the way for organs that can better mimic natural functions and last longer in the body. The ultimate goal is to provide effective long-term solutions for patients who need them, improving quality of life and survival rates. Summary: artificial organs are a remarkable achievement of modern medicine and engineering. They offer hope to millions who suffer from organ failure or loss, bridging the gap where natural transplants are not possible. While challenges remain, especially regarding adaptability and longevity, the field is rapidly evolving. With continued innovation, artificial organs will play an even greater role in healthcare, transforming lives and redefining what's possible in medicine.